There are currently 93.3 million obese adults in the United States. That includes close to 40% of the adult population. An additional 34% of the American adult population falls into the overweight category. Thus, 75% of American adults have an increased risk of developing cancer due to body fatness. In Iowa, we have the fourth highest obesity rate in the country. It has been estimated that obesity-related cancers accounted for 40% of all cancer diagnoses in Iowa in the year 2015. In women, the percentage of obesity-related cancers was 55%, and in men, 24% in 2015. Maintaining a healthy weight throughout life is one of the most important ways to protect against cancer. Obesity is associated with inflammatory mediators and metabolic and endocrine abnormalities that promote cell growth and exert anti-apoptotic or anti-death effects, meaning cancer cells do not self-destruct even following severe DNA damage. Greater body fatness is a cause of many cancers, and this association has grown even stronger over the last decade. Accumulating evidence points to the importance of the systemic inflammatory milieu of the body, as reflected in anthropomorphic measurements such as body fatness, as being a key determinant of cancer susceptibility. In the obese state, many of the metabolic and endocrine abnormalities associated with obesity, such as elevated levels of insulin and estrogen, as well as inflammatory mediators associated with obesity, exert proliferative effects. Proliferative means causing cells to grow. Thus, in the obese state, there is general upregulation of cell growth. Obesity is recognized as a chronic inflammatory state that predisposes to cancer, and chronic inflammation has been implicated in the link between nutrition and cancer. Cancers associated with increased body fatness include mouth, pharynx, and larynx cancers, esophageal, stomach, liver, and pancreas cancers, gallbladder, postmenopausal breast cancer, kidney cancer, colorectal cancer, endometrial cancer, ovarian cancer, prostate and thyroid cancer, as well as multiple myeloma. It is well established that body fatness has a causal role in the development of several other diseases, including type 2 diabetes, dyslipidemia, which is abnormal blood fats, high blood pressure, stroke, coronary artery disease, as well as digestive and musculoskeletal disorders. Here are some of our current recommendations. Number 1, ensure that your body weight during childhood and adolescence projects towards the lower end of the healthy adult BMI range, which is between 19 and 25. Keep your weight as low as you can within the healthy range throughout life. The ideal BMI range is between 19 and 25. Avoid weight gain throughout adulthood. Be moderately physically active, incorporating at least 30 minutes of walking into your daily life at least 5 days per week. For every hour of sitting, get up and move for 10 of those minutes. Physical activity plays a huge role in keeping your body healthy, and here's how. Exercise has been shown to promote healthy immune and hormonal systems. It has beneficial effects on cancer risk, likely through multiple mechanisms such as reduction in circulating estrogen levels, insulin resistance, and inflammation, all of which have been linked to the development of cancer. Physical activity improves insulin sensitivity, which means our cells' ability to use insulin, and it reduces fasting insulin levels. It has been shown to enhance immunity and promote tumor surveillance, meaning it helps our natural cells look out and destroy cancer cells. Physical activity can also decrease oxidative stress and enhance DNA repair mechanisms, decreasing the potential development of cancer cells. The bottom line is that being overweight or obese is a major risk factor for the development of cancer. We should do everything in our power to achieve a normal body weight and stay there. Next time, I will discuss strategies for cancer prevention, including tobacco use, weight management, and alcohol use. Stay tuned for a thought-provoking discussion.